people who experience breakthrough infections with Delta are actually more able to transmit the infection to others compared to people who had breakthrough infections with other versions of COVID-19, like the Alpha variant. I know, we don't want to go back to wearing masks again, but these masks are a layer of protection that will help us prevent spread at a time where we are seeing cases rise.
Following the CDC's revised guidance on masks, Nevada will reinstate a statewide indoor mask mandate starting Friday in counties with substantial or high COVID transmission. The Associated Press reports at least 12 counties will be affected, and that includes Clark County, which is home to Las Vegas. New COVID infections in Nevada have surged. The state reported over 1,100 cases today. That's the highest one-day increase since January. The number of people hospitalized has also spiked. The Las Vegas Review-Journal reports, quote, data showed that 1,143 people with either confirmed or suspected cases of COVID-19 were hospitalized in the state, unchanged from Tuesday's report. Hospitalizations also have been climbing since reaching a recent low of 209 on June 12th. For more, we welcome to the broadcast Dr. Luis Medina-Garcia. He's an infectious disease specialist at University Medical Center of Southern Nevada in Las Vegas. And I note, Doctor, thanking you for being with us tonight, that you are wearing your mask. Describe what's going on in Nevada and what kind of patients you're seeing.
Correct. So, unfortunately, we've seen a significant increase in the cases in our community. We are labeled as one of those communities that have high transmission by the CDC. It's multifactorial for us. On one hand, the low amount of vaccinated patients, people that we have in the state, and then adding to that the tourism aspect of it, the decrease in mask wearing mandates across the businesses, and just overall increased exposure. So that's what is driving the current surge.
And is it going to get worse before it gets better? Do you foresee this spike in hospitalizations continuing? I mean, you said something that I had not heard from anybody before. You said if you aren't vaccinated, getting COVID is inevitable. It should scare people.
And so I'm not trying to scare people. It's just a matter of time, right? If it's statistics, if you are in a vulnerable state and you have an increased rate of transmission of a highly infectious disease, chances are that you will get infected at some point. So now we have the ability to prevent these infections. Even if you get a breakthrough case of COVID, the vaccines prevent you from getting hospitalized and they prevent you from dying. So it's a marked improvement as it was from last year. And it allows us also to remind people that you have the ability to do something about it. Last year, we were helpless. Now we have the tools that we didn't have before.
So you've got the tools. So, doctor, what are unvaccinated patients telling you? Why aren't they getting the shot?
So it's a large spectrum of reasons. Some of them come out of fear, some out of distrust. But I think we need to meet people where they are, right? You have to spend the time to talk to them and understand what their hesitance is coming from, and be able to point them to reputable sources of information. And I have seen success in having patients then become vaccinated after that.
Yeah, I know you don't want people to get vaccinated out of fear, although it can be a powerful tool. And I wonder if where you are, as far as you can tell, has the Delta variant helped at all to convince more people to get their COVID shots?
Absolutely. This new variant is much more infectious than the previous one. And this is just the result of evolution of a virus, right? The virus's mission is to survive, and it finds way around the roadblocks that we place for it. So, people see the death toll, people see the burden of disease, and then I try to convince them that getting vaccinated is a matter of love, not just for your personal love, but also for those that you care for. And so by taking care of yourself, preventing infection in yourself, you're protecting your loved ones as well.
So Clark County, obviously, as we mentioned, is going to fall under the indoor mask mandate reimposed by the state. Are you worried that folks won't wear a mask anyway? And you kind of touched on this at the top, but you have a unique situation with Las Vegas, which is huge numbers of people coming in from elsewhere.
And it is an inconvenience for people. And I understand how backpedaling into the previous guidance can make people distrust. But remember that science doesn't change. It's just the new knowledge that you acquire from science. If there's something that this virus has had to teach us is to be humble. What we think we know with what we actually know when you apply science and give it enough time. So it's a minor burden. There's been some studies published out of Spain where they did concerts with upwards of 5,000 people. All of them were tested, all of them wore masks, and there was minimal transmission of the disease. We want to keep our businesses open. This is the lifeblood of the state's economy. We need your help. We need your help to keep that going.
It does feel like deja vu all over again, not just where you are, but unfortunately at so many places around the country. How are you doing? How are the doctors and nurses and everybody who works at University Medical Center doing as they continue to see this upswing, this surge going on?
It's very difficult. People hear about burnout. One of the doctors that I admire, Zubin Damania, he calls it moral injury. And essentially, it's your inability to be able to do good for your patient. This disease is something that we haven't been able to conquer. The best fight is the one that you choose not to get into. And so by getting vaccinated, you can help us not have to take care of you in dire situations. Last year, we were called heroes because we had to. And now you can help us put your cape on and prevent the tragedy.